I had taken a shower and gotten water in my ear, I thought. I went to the doctor. They thought I had an ear infection. He found a mass of some sort in my ear. When he went in for surgery, it was kind of an exploratory surgery. Well, he found a schwannoma on my facial nerve. He removed it, and in removing it, he did burn my facial nerve and paralyzed the left side of my face. Immediately when I got out of surgery, I said, "My face is drooping, isn't it?" And he tried to tell me that it was a nerve block and that it would wear off in 24 to 48 hours. It was very depressing. There was a time when I was just kind of like, I don't want to go out in public, I don't want to go anywhere. A year and a half later, I had facial reconstruction surgery with Dr. Heckman, and then made it to where I can smile on that side.
The entire side of her face was unable to move after this surgery that she had had. And so in those cases, a lot of things are impacted. Your ability to close your eye, and if you're unable to fully close your eye, then your eye is at risk of drying out and potentially losing sight to that eye if it's not taken care of. You also lose your ability to express emotions and happiness and sadness. And the other part that's difficult is when someone sees you with one side of your face that isn't moving, you look asymmetric, you don't look normal. And people pick up on that immediately. So the impact that these type of things have on your quality of life are very high. We put a weight in the upper eyelid to help her be able to close her eye again. And then when we were sure that there was no chance of the facial nerve function returning, then we proceeded with nerve transfers and also some static procedures, during the process of which her tone and some of her movement comes back. What I'm currently doing is combining 2 nerve transfers at once. One of the nerve transfers provides the tone coming back to the face. So over the course of 6 months after that nerve transfer has been performed, the face starts to lift back up into a more symmetric fashion at rest. The other nerve transfer that I do, and I combine this with the other one in the same surgery, is where I take a nerve that allows you to clench your jaw, and instead I hook it up to the main branch of the facial nerve, which is paralyzed, the one that allows you to smile and to move your mid-face. After about 6 to 9 months, then they have the opportunity to, when they clench their jaw, they start to be able to smile again. From a timing standpoint, you want to try to do that between the point of the injury and 2 years, because if you wait further than 2 years, then those muscles that used to have the ability to move, and those muscles that are able to hold up your face with good tone atrophy, and then you have a different set of issues that you have to deal with. There's a lot of therapy that also goes into working with these patients and trying to help them get back to a point where they feel comfortable being out in public, where they feel comfortable that their face is looking more symmetric and they can interact with people and not be worried that they're being stigmatized. Having her come in to where she wasn't able to move anything on the side of her face, and now she can get back to a somewhat symmetric smile. It's so rewarding to see how happy she is to get back to that point. And it's motivating. It makes me want to continue to do these types of surgeries and helping out people.
I think he's done a great job. He keeps doing before and after videos and pictures. And I don't see the changes because I see it every day. But when he shows me those before and afters, I'm just like, whoa. I mean, it's drastic. That my face was drooping horribly. I am very, very pleased. They treat me like family here. I mean, everybody knows me. Everybody is very polite, very kind. It's been a really great experience.